Have you ever wondered why lung cancer is considered one of the deadliest diseases globally? It's a question we need to ask, as understanding lung cancer, its risk factors, causes, and prevention is vital for our health. Stay with us as we delve deeper into this critical health issue. So, what exactly puts a person at a higher risk of developing lung cancer? Well, numerous factors come into play, and it's crucial to understand that anyone can get lung cancer, but certain risk factors significantly increase the likelihood. Let's start with the most common one: smoking. Cigarette smoke is a toxic mix of over 7,000 chemicals, many of which are proven carcinogens. The more a person smokes, the higher the risk. Even if you're not a smoker, exposure to secondhand smoke can also put you in the danger zone. Yes, inhaling the smoke from someone else's cigarette can increase your risk of developing lung cancer by up to 30%. Now, moving on to a risk factor you might not be as familiar with: radon gas. Radon is a naturally occurring radioactive gas that can build up inside homes and other buildings. Prolonged exposure to high levels of radon can lead to lung cancer, making it the second leading cause of the disease. It's invisible, odorless, and tasteless, but its impact is significant. Next up, let's talk about family history. If lung cancer runs in your family, whether it's because of genetic factors or shared environmental exposures, your risk is higher. So if your parent, sibling, or child has had lung cancer, it's something to take note of. Certain occupations also increase the risk of lung cancer. Workers exposed to asbestos, for instance, are 7 times more likely to die of lung cancer. Other hazardous substances such as uranium, arsenic, and certain petroleum products can also increase your risk. Lastly, let's touch on air pollution. Long-term exposure to polluted air, especially heavy traffic pollution or indoor wood-burning stoves, can increase the risk of lung cancer. In fact, the World Health Organization classifies outdoor air pollution as a major carcinogen. It's important to remember that having one or even several of these risk factors doesn't guarantee that you'll develop lung cancer. It merely means your risk is higher than average. Not everyone who gets lung cancer has these risk factors, and many who do have the risk factors don't develop the disease. Nevertheless, understanding these risk factors is a significant part of the puzzle. It can help you make informed decisions about your health and take steps to reduce your risk. For instance, if you're a smoker, quitting is the best thing you can do for your health. If you're exposed to secondhand smoke, find ways to limit your exposure. If radon is a problem in your home, there are ways to reduce your exposure to it. Knowledge of these risk factors is the first step towards prevention. By arming yourself with this information, you're better equipped to make choices that could potentially save your life. So stay informed, stay vigilant, and most importantly, stay healthy. Now that we understand the risk factors, what are the causes of lung cancer? Lung cancer, like many other types of cancer, doesn't have a single cause. It's a complex disease resulting from a combination of genetic factors, environmental exposures, and lifestyle choices. However, certain causes stand out as primary contributors, with the most significant being smoking and exposure to certain harmful substances. Let's delve into the big elephant in the room: smoking. It's a fact that the majority of lung cancer cases are directly linked to cigarette smoking. When you inhale cigarette smoke, which is full of cancer-causing substances, carcinogens, changes in the lung tissue begin almost immediately. At first, your body may be able to repair this damage, but with each repeated exposure, normal cells that line your lungs are increasingly damaged. Over time, the damage causes cells to act abnormally, and eventually cancer may develop. Smoking cigars and pipes also increases the risk. It's not just the smokers themselves who are affected. Secondhand smoke, or breathing in the smoke from others' cigarettes, cigars, or pipes, can cause lung cancer in non-smokers. Long-term exposure to secondhand smoke is like being a smoker yourself. Now let's move on to another major cause: exposure to certain chemicals and substances. This includes a plethora of harmful agents such as radon, asbestos, uranium, and certain petroleum products. Radon is a naturally occurring radioactive gas that results from the decay of uranium in soil and rocks. It's invisible, odorless, and tasteless, and can accumulate in homes and buildings. It's the second leading cause of lung cancer, and the leading cause among non-smokers. Asbestos, a group of minerals that occur naturally as bundles of fibers, was widely used in construction, insulation, and fireproofing materials. When these fibers are inhaled, they can damage lung cells and lead to lung cancer. It's particularly dangerous for smokers, who have a much higher risk if exposed to asbestos. Exposure to other dangerous substances such as uranium, arsenic, cadmium, and some petroleum products can also increase the risk of developing lung cancer. These substances can cause changes in the lung cells, leading to cancer. In essence, the causes of lung cancer are multifaceted and often intertwined. It's a complex interplay of genetic, environmental, and lifestyle factors. But among these, smoking and exposure to harmful substances stand out as the most significant causes. By understanding these causes, we can better comprehend how lung cancer develops, and importantly, how we can reduce our risk. Understanding the causes can help us make informed decisions about our health. So, how can we protect ourselves and our loved ones from this deadly disease? This question is pivotal, considering the gravity of lung cancer. It's a disease that doesn't discriminate, affecting people from all walks of life. But fear not, there are various preventive measures we can adopt to reduce our risk significantly. Now let's delve into these preventive measures. First and foremost, if you're a smoker, it's time to say goodbye to the habit. Smoking is the leading cause of lung cancer, accounting for about 80 to 90% of lung cancer cases. It may seem a daunting task to quit, but it's never too late to stop. Quitting smoking at any age can lower your risk of lung cancer. But what about those who don't smoke? Well, you're not exactly off the hook. Secondhand smoke, that is, smoke that you inhale from others' cigarettes, cigars, or pipes, can also increase your risk of lung cancer. It's not just a mere annoyance, it's a serious health risk. So, avoid secondhand smoke as much as possible, whether it be at home, at work, or in public places. Next on our list is radon, a naturally occurring radioactive gas that you can't see, smell, or taste. It can become trapped in homes and buildings and is the second leading cause of lung cancer. Therefore, it's important to test your home for radon. If the levels are high, you can take steps to fix it. Radon test kits are readily available and are easy to use. Certain occupations also carry a higher risk of lung cancer due to exposure to carcinogens like asbestos, arsenic, diesel exhaust, and some forms of silica and chromium. If you work in such an environment, take necessary precautions. Follow your employer's safety instructions, wear protective equipment, and make sure you're working in a well-ventilated area. Now let's talk about regular checkups and early detection. While these steps may not prevent lung cancer, they can help catch the disease in its early stages, when it's more treatable. Regular checkups are crucial, especially if you're a smoker or have a history of lung cancer in your family. During a checkup, your doctor may perform tests to look for lung cancer before you have any symptoms. Early detection is key. If lung cancer is found at an early stage, it's more likely to be successfully treated. So don't ignore any unusual symptoms. If you have a persistent cough, chest pain, shortness of breath, or unexplained weight loss, it's time to see your doctor. A healthy diet and regular exercise can also play a role in lung cancer prevention. While research is still ongoing, some studies suggest that a diet rich in fruits and vegetables may help protect against lung cancer. And regular exercise can help maintain a healthy weight, which can also reduce your risk of lung cancer. Lastly, let's not forget about vaccination. Vaccines against infections like the human papillomavirus, HPV, and hepatitis B can reduce your risk of some types of cancer, including lung cancer. The road to prevention may seem long and winding, but each step you take is a step away from lung cancer. Remember, it's not just about adding years to your life, but adding life to your years. Prevention is always better than cure, and this rings especially true for lung cancer. Let's take a moment to review what we've learned today. We've journeyed through a comprehensive understanding of lung cancer, dissecting the risk factors, causes, and most importantly, the prevention methods. We began by unveiling the various risk factors associated with lung cancer. These include smoking, exposure to secondhand smoke, exposure to radon gas, and family history, among others. It's important to note that while these factors increase the likelihood of developing lung cancer, they don't guarantee it. Next, we dove into the causes of lung cancer. At the forefront is smoking, which accounts for about 7 out of every 10 cases. But remember, non-smokers are not immune to lung cancer. Other causes include exposure to certain chemicals and substances, such as asbestos and diesel exhaust. Our exploration then led us to the most empowering part of our discussion: prevention. We learned that many cases of lung cancer can be prevented, or the risks significantly reduced through a few key actions. Quitting smoking, avoiding secondhand smoke, testing homes for radon, and maintaining a healthy lifestyle are just a few of the preventive measures we can take. In essence, our awareness and understanding play a crucial role in lung cancer prevention. Knowledge of the risk factors and causes equips us to make informed decisions about our health, and the adoption of preventive measures empowers us to significantly reduce our risk. Remember, the power to prevent lung cancer lies in our hands. Let's make informed decisions and live healthier lives.